Hello and welcome to the MDS podcast, the official podcast of the International Parkinson and Movement Disorder Society. I am Michele Matarazzo, the editor-in-chief of the podcast and your host today. Every year, our society acknowledges the work of two young members, 40 years of age or younger, who submit top-ranked abstracts for the annual International Congress. The two awardees received the Junior Awards and are invited to speak about their research during the Congress. We have the great pleasure to have with us one of the awardees of this year, Dr. Bahne Bahners, who is currently a research fellow at the Brigham and Women's Hospital and Harvard Medical School in Boston. Bahne, thank you very much for joining and congratulations.
Thank you so much, and thank you for giving me the opportunity to join the podcast.
Yeah, so this is called the Junior Award because it's for younger people. Can I ask you, how old are you, and a little bit of your background? Where are you from? What has your career been so far? And also, how did you end up working in the field of Parkinson's disease? Was it something you always wanted, or it just happened?
So I'm 30 years old right now, and I've started medical school, I think now something like 10 years back. And before starting medical school, I've been in a caregiver internship, and I've been on a neurological ward, and I've seen many patients with movement disorders there. And it somehow fascinated me how you could, by just looking at a patient and how their movements were, could already infer which kind of diagnosis you give that patient and what might be wrong in the brain. So that already fascinated me early on, like before starting medical school even. So I had an interest in neurology, and then that developed into an interest in movement disorders, particularly. In my MD thesis in Düsseldorf at the University Hospital, I've worked in the MEG lab with Markus Butz and Alfons Schnitzler on Parkinson's disease and deep brain stimulation. And that's when I started to also develop an interest in electrophysiology and deep brain stimulation. And then after a 2-year postdoc after med school with Esther Florin and Alfons Schnitzler and in the MEG lab, I started residency in neurology. And I've been working a lot in the DBS outpatient department. I was lucky to also see many different patients with movement disorders there.
And how did you end up in Boston?
So after my postdoc, I applied for a Parkinson Fellowship, which is awarded by the German Thiemann Foundation, which is a foundation founded by a person with Parkinson's disease who was a radiologist in Germany. And he founded this foundation to fund young people that are interested in Parkinson's disease research. And I got this award and was lucky to join Andreas Horn's lab in Boston, who's obviously a rock star in DBS research.
So now, going from that award to this current award, I am actually not sure how many abstracts are sent to the meeting each year, but being one of the top abstracts is definitely a great recognition of your work. So you definitely must be proud. Have you attended this MDS Congress before and sent abstracts before, or is this your first time?
It's actually my first time, and that was unfortunately due to COVID. I wanted to go to MDS before, but it was exactly when COVID happened, so I didn't. But yeah, I'm excited that in my first Congress I'm able to win.
I mean, I'm telling you, it's unlikely that you're gonna receive an award every Congress. So it's not the first one is gonna be like this, but probably the other ones are not gonna be. I hope so, but you never know.
Fine.
Now, the title of the abstract is Oscillatory Network Mapping of Deep Brain Stimulation Outcomes in Parkinson's Disease. Now, to be honest, I only had access to the abstract, as you know, and it seems very novel and also quite complicated, especially in the analysis. Can you guide us through the methodology and the main results of the study?
Sure. Yeah. So basically, working with Andreas Horn brought me to that topic a bit. The idea was that if we're able to map DBS outcomes using fMRI and structural MRI based on the electrode location, so calculating connectivity of the DBS electrode to any other brain region using a normative connectome, so fMRI connectome, for example, where we have an fMRI time series for the electrode, And then for each other region of the brain, we can say, okay, this particular spot where the electrode is stimulating is connected to the other regions of the brain in a certain way. And this methodology is established already and has been shown in many publications to work to estimate DBS outcomes. So what we wanted to use electrophysiology, where we don't only have a static image at one particular point in time or a very slow time series in fMRI, but can actually resolve these time dynamics that are important in Parkinson's disease. For example, beta band changes, which have been shown to be very important. So we really wanted to address this issue of the temporal resolution for DBS network mapping as it has been done before. The idea was we take this huge data set we have in Düsseldorf and Berlin, which is unique because we collect data from the DBS electrode, where we have LFP recordings on the day after surgery, where DBS electrodes are externalized, and record cortical activity using MEG the same day in parallel. And this is a unique opportunity to look at the actual electrophysiological connectivity between the stimulation side of the DBS electrode and all of the other cortical regions. And that can only be done if you have these combined recordings, of course. And to make use of that, we then calculate the coherence between the local field potential time traces and the cortical time courses. Coherence is a correlative measure or a correlation of signals in the frequency domain.
Mm-hmm.
And that gives us an idea of how the STN is electrophysiologically connected to the rest of the brain. We hypothesized that that connectivity pattern would be helpful to estimate which patient responds well and which patient doesn't respond well. So what we did was we calculated the coherence for each of the DBS electrodes, which were across the two cohorts we have in Düsseldorf and Berlin, 100 DBS electrodes. And we calculate the coherence to the cortex and use that coherence as a map, the oscillatory network map for each individual electrode. These individual maps are then correlated with, so in each voxel, this map is correlated with the DBS outcomes, so the UPDRS percentage improvement 1 year after surgery for each of these 100 electrodes.
Mm-hmm.
So what we get is in each voxel a correlation between these 100 voxel coherence values at the cortex and the 100 UPDRS improvements. And that gives us a correlation value for every voxel in the brain. And this correlation tells us how well this oscillatory connectivity or the coherence correlates with the UPDRS outcome. So we, at the end, get a map that shows us which regions are mostly correlated to DBS outcome in which of the frequency bands. And we create multiple maps for multiple frequency bands and also do that for symptom-specific outcomes.
Okay. And what did you find? I mean, what does this map look like?
So first of all, the coherence map, as in the grand average across patients, looks exactly as we expected and as we have seen in the studies before. So the theta alpha connectivity network has a frontal and temporal pattern, which has been described earlier. So the coherence of STN signals is strong in the theta alpha band to temporal and frontal areas. In the beta band, be it low or high beta, we see strong coherence to the motor regions. And that has been shown before. If we now look at the correlation maps, so the maps that show us which regions are relevant for DBS outcomes, we see that low beta and high beta maps actually differ, and even though the grand average is very similar. So the low beta map shows a positive correlation across the motor strip, while the high beta map shows a negative correlation across the motor strips. And this relationship gets even stronger if we only look at bradykinesia, for example. So for bradykinesia, the high beta map has a very strong negative correlation across central areas, which is not that apparent if we look at the total UPDRS, for example.
And did you just maybe you didn't look at that, but did you find something if you just look at the tremor specifically?
Yes, if we look at the tremor-specific correlation map, we were able to see a very strong positive correlation in central and frontal regions in the theta alpha band, which would be in line with previous knowledge on the tremor network in the theta alpha band and would make sense in this regard.
Okay. Now, how do you think these results will impact the future treatment options for Parkinson's disease?
So this project is still ongoing. We'll have to see if we're able to validate the maps in our second cohort and the external cohort that we also that we got from our colleagues in Berlin. And if that holds true and it looks as if this high beta finding might be promising for bradykinesia, that could be an option to translate that into easier, more applicable imaging methodology. So not using MEG because it's very, very rare across centers. So if we would want to transfer that to clinical practice, we would definitely need to try that next with EEG. So having combined LFP EEG recordings, potentially even with the novel sensing-enabled DBS devices where we can record both local field potentials and cortical signals, and then look at the pattern. And if we find one of the 4 DBS contact levels, for example, a pattern that resembles our map a lot, that would potentially be the best or the optimal DBS contact. And that could be a way to find the optimal DBS settings in some of the patients, potentially.
Okay, so you kind of use a map as a biomarker to define which are the best tuning of DBS in a given patient, right?
Exactly. Yeah.
Well, that sounds really interesting. Now, when are we going to see the paper published? Because this is just the abstract, but when do we expect to see this out?
So we're about to finish the validation in the external cohort. It's a bit difficult to say how long that takes and if we need another validation step. But yeah, I hope that by the end of next year it will be published, but it's still ongoing progress. Yeah.
Now, what are the next steps in this specific project? I mean, apart from the things that you already explained, if you have other ideas to expand this project to study LFB in deep brain simulation and maybe the use of cortical mapping along with that? And also, what are the next steps in your career? How do you envision your career in the next few years?
Yeah, so besides that project, we have another important project going on with DBS evoke potentials, where we actually engage with the network, and that works very well and perhaps even a bit better than the resting state data I present here in that abstract. And that could just be related to the fact that we actually engage with the network when we record DBS evoke potentials. So that project is a bit closer even to publication, and you'll hear about that soon, hopefully. And then together with that MEG project, the resting state project, I'd envision to develop some kind of an electrophysiological examination after DBS surgery that could help us to program patients a bit faster, potentially combining both methods. So having an EEG recording together with LFPs as well as DBS evoke potentials and determine which contact is the best for that patient to just improve this very lengthy process of DBS programming. So that would be my scientific perspective or aim in that regard. And then I need to go back to Germany soon. So by the end of the
Okay.
year, my contract ends here, and I will have to finish my. I want to finish my residency in neurology in Germany to also be able to treat patients because I love that as much as I love research. So I definitely have to
So
work on that.
you're gonna do both things. So you're gonna be a clinical scientist to do both things, right?
Yeah. Yeah.
Well, this is great. Congrats again for the award. I really look forward to hearing more from you and your work in the future. Thank you again for joining me today.
Thank you so much.
Our guest today has been Dr. Bahne Bahners, who is currently a research fellow at the Brigham and Women's Hospital and Harvard Medical School in Boston, who is one of the recipients of the International Parkinson and Movement Disorder Society Junior Award for 2024. Thank you all for listening.
The views and opinions expressed by the participants in this podcast do not necessarily reflect those of the International Parkinson and Movement Disorder Society or their affiliated journals, Movement Disorders and Movement Disorders Clinical Practice. Any disclosures of the participants can be found within the episode description located on the MDS website.